your help today. For centuries, people have been touting the health benefits of tea. And recently, medical studies have shown those claims, or at least some of them, are true. And here to tell us which teas we should be drinking and for what is Dr. Andrew Carroll, back with us on this Monday morning. You are a tea drinker?
Just a little bit in the evenings. I like.
Which kind do you drink?
I drink green.
Green tea. Well, what do you want to kick it off with? Can we talk about green tea? That's the one you hear most commonly.
Right. Green is thought to fight cancer. That's the big one that you hear about nowadays. And there's a lot of evidence that shows that that's true. They did a study where they had 2 petri dishes with bacteria in it, and one petri dish had green tea in it, one did not. And then they exposed that bacteria to tobacco carcinogens. And the one that was in the green tea did not mutate as much as the non-green tea.
That is interesting.
Now, that may not apply to humans, but that's good evidence to show that this might be true. And they think that there's a genetic predisposition to that benefit. So if you are a person who is particularly susceptible to oxidative stress, they think that green tea may help you. And quite honestly, what would it hurt?
It's worth it, even though there may not be extensive testing.
Right. And they think that green tea, you know, the funny thing is I was watching 2020 on Friday and they did that John Stossel thing. And they showed that they thought that green tea wasn't giving people that benefit. But I don't think there's been enough population studies to show that's the case. It's also been shown to help with kidney stones and also with other such.
This sounds like a miracle beverage, but black tea is good for you too.
Black tea is wonderful. They did a great study where they took, I think it was about 200 people. All of them had heart attacks, and 100 of them they gave green tea, four cups of green tea. That's a lot. And then the other just water. And then about a month and a half later, they looked at their blood flow in their hearts, and they showed that the black tea drinkers actually had arteries that opened and closed better than the non-tea drinkers.
Wow, and exercise didn't have any effect on that.
Well, I think they both were in the same groups as far as rehabbing and everything, and then just gave them different stuff to drink.
Boy, that's compelling.
And and they also think that black tea also helps with the cancer prevention as well.
Let's talk about chamomile tea. A lot of people drink that right before bedtime to soothe them. What else? What other benefits do you have?
Chamomile can help with relaxation and anxiety. I think people use it mostly for that. But there are other benefits of chamomile tea. It's thought to help with cold symptoms. And I don't know if they've done a study to show whether or not that might be just drinking hot water as compared to drinking chamomile tea. And then the other is menstrual cramps. They found that some women benefited from chamomile tea with their menstrual cramps.
Well, that's nice. Does it help at all in the mental capacity there at PMS time?
I don't know. Maybe we got to get somebody to try it.
I think we need to try some of our own studies here. Alrighty. Well, let's talk about what if you drink too much tea? Are there any side effects?
Yeah, they looked at some of the people who were taking too much of it, and especially chamomile. They looked at people who were drinking too much chamomile tea, and they felt that these people were experiencing a lot of side effects, mostly due around the eyes for some reason. That people were having some edema of the eye tissue, and they were looking at specifically with people who were having eye surgery. They're looking at people who were drinking chamomile tea and who were not.
Okay.
So.
Finally, may I ask you about chai tea? Because Kaylee and I get this non-fat, no-water chai latte, Starbucks all the time.
I love chai.
Does chai do anything for us?
Yeah, I don't think they've done that study. I think Starbucks should probably, sponsor a study on that. But one thing about teas that you get in the bottles and stuff, they may be great. A lot of them have a lot of sugar in it, so you just got to be careful about that.
Yeah, lots and lots of calories then to go with it. Thank you so much, Dr. Andrew Carroll. And for more information or to contact Dr. Carroll, call the Renaissance Family Medical Center at the number right there on your screen.